Have you noticed your mother forgetting important appointments or your father getting lost in simple conversations? At some point, nearly every caregiver or family member faces this question. Is this a natural part of aging or a sign of something more serious? As life expectancy increases, it's becoming more common to live with aging parents, grandparents, or partners. And with that comes small changes in behavior and memory that can raise concern. But not every lapse in memory is cause for alarm. And at the same time, ignoring certain signs can delay an important diagnosis. Being able to tell the difference between what's expected and what needs attention is key to ensuring a better quality of life, safety, and independence for older adults. That's the goal of this video, to provide clear, evidence-based information to help you recognize the signs of cognitive decline and understand what's part of normal aging. Over the next few minutes, we'll explore these two paths together, and by the end, you'll have a better sense of when it's time to seek medical help, because caring begins with knowledge. What is normal cognitive aging? As we age, it's natural for the body to change. Vision may weaken, reflexes may slow down, and physical endurance tends to decline. Something similar happens with the brain. Normal cognitive aging is part of this process and, in most cases, does not indicate any disease or warning sign. The aging brain remains functional but responds differently. Some cognitive abilities, such as short-term memory, processing speed, and attention span, tend to decline gradually. This means a person might take longer to recall someone's name, need more time to understand new instructions, or become more easily distracted. However, in these cases, the forgotten information usually comes back after a while, and the person's independence remains intact. It's common, for instance, for an older adult to forget where they placed their glasses and then find them on their own a few minutes later, or to not immediately recall the name of an acquaintance, but remember it with a hint or some context. These lapses are occasional, mild, and don't significantly impact daily life. Another important point is that while some functions decline over time, others remain stable or even improve. Vocabulary, general world knowledge, and accumulated life experience tend to stay intact and often make older adults wiser and more thoughtful in their decisions. In other words, the brain may be slower, but it's still effective, like a computer that takes a bit longer to open programs but still works just fine. In normal aging, there is no loss of spatial orientation, nor confusion with dates, simple routines, or familiar faces. A person may be more cautious when performing certain tasks, such as driving at night, but still knows exactly how to do them. Small adjustments are common and expected. Understanding this is essential to avoid two extremes: denial, ignoring concerning signs, or hypervigilance, believing that every memory lapse is a sign of illness. Not every forgetfulness is a red flag, and distinguishing between what's expected and what's abnormal helps ease anxiety for both caregivers and aging individuals. By understanding what's natural in the aging process, you're better equipped to provide care with calm and confidence. At the same time, you'll be more prepared to identify when something is out of the ordinary and deserves attention. That's exactly what we'll explore next: the signs that may indicate cognitive decline and should not be mistaken for healthy aging. Signs of cognitive decline: what falls outside the norm. While normal aging involves mild, gradual changes that don't interfere with a person's independence, cognitive decline is a cause for concern. It shows up as more intense, persistent, and often progressive changes. We're no longer talking about occasional memory lapses. This is a real deterioration of mental functions that significantly impacts daily life. One of the first signs that something may be wrong is the frequency and intensity of forgetfulness. When someone starts repeatedly forgetting important information, like scheduled appointments, recent conversations, or the names of close people, and can't recall them later, it's a red flag. Forgetting where you put your keys is common. Forgetting what keys are used for is not. Another key sign is difficulty performing routine tasks that used to be done with ease. Making breakfast, for example, might become confusing. The person forgets the steps, mixes up ingredients, or gives up halfway through because they can't remember what they were doing. These changes indicate problems with working memory and planning. Orientation is also affected. A person may get lost in places they've visited for years, like the way home or the local grocery store. They might forget the current date, the name of their street, or even the day of the week. This goes beyond simply mixing up medication times. It's not knowing whether it's morning or evening, or if it's Monday or Sunday. Behavior and mood changes are also common. People experiencing cognitive decline may become more irritable, suspicious, or emotionally unstable. They may show signs of depression or anxiety without an apparent reason. In some cases, episodes of aggression, apathy, or social withdrawal occur. These changes are often noticed by family members before memory problems become obvious. Another often overlooked sign is excessive repetition. A person may ask the same question several times in a short period, even after receiving an answer moments before. This shows difficulty in retaining new information, something that doesn't happen in normal aging. A decline in judgment and decision-making abilities is also common. The person might make risky choices, such as leaving the house alone with no destination, or falling for simple financial scams, even if they were once very cautious. This loss of discernment can create dangerous situations for both the individual and those around them. It's important to note that cognitive decline can begin subtly. At first, the signs may be mild and mistaken for normal aging. That's why observing the context is essential. Changes that affect daily functioning become more frequent over time and seem unusual to those close to the person should raise a red flag. The progression of symptoms is also a key factor. In healthy aging, memory slips tend to remain stable over the years. But with cognitive decline, they worsen, leaving the person increasingly dependent and confused. The loss of independence stops being a future concern and becomes a present reality. Recognizing these signs is the first step toward early intervention. Families often delay seeking help out of fear, denial, or lack of information. But the sooner a medical evaluation is done, the better the chances of slowing down the condition's progression and preserving the person's quality of life. Comparison chart: normal aging versus warning signs. After understanding what characterizes healthy cognitive aging and the signs of possible decline, it's helpful to see these differences side by side. This comparison makes an often emotional or subjective perception more objective. Below are some of the most relevant contrasts between the two conditions. Remember, context, frequency, and impact on daily functioning are the key distinctions. Memory: normal, forgets someone's name but remembers it later. Warning: forgets the name of a close family member and can't recall it even with prompts. Communication: normal, has trouble finding a specific word but can still express themselves. Warning: frequently forgets common words or uses the wrong ones, making speech hard to understand. Daily tasks: normal, might forget an ingredient while cooking but notices and corrects it. Warning: can't remember how to prepare a familiar dish or gets lost in the middle of the task. Orientation: normal, momentarily forgets where the car is parked. Warning: doesn't recognize the way home or gets lost on familiar routes. Judgment and decision-making: normal, takes longer to make decisions but still thinks clearly. Warning: makes illogical, impulsive, or dangerous decisions, like giving away large sums of money without reason. Mood and behavior: normal, becomes more impatient or sensitive but maintains emotional bonds. Warning: shows sudden mood swings, excessive suspicion, aggression, or sudden social withdrawal. Independence: normal, lives independently with minor adjustments. Warning: frequently needs help with basic activities, like dressing or remembering to take medications. This comparison chart doesn't replace a medical evaluation, but it serves as a helpful at-home tool to guide your observations and decisions. If more than one of these warning signs appears frequently and impacts daily life, it may be time to seek professional guidance. When it's time to seek medical help, after noticing signs that go beyond what's expected, the inevitable question arises, is it time to see a doctor? This is a common doubt among family members and caregivers, especially in the early stages of cognitive decline when symptoms are still subtle. The answer, in most cases, is the sooner, the better. Seeking medical help should be considered whenever forgetfulness becomes frequent, persistent, and starts to interfere with daily activities. If the person begins to repeat information multiple times during a conversation, gets lost in simple tasks, or shows confusion with dates, names, or places, it's a sign that something has changed in brain function, and that deserves proper investigation. Another important indicator is when family members or close friends notice changes. Often, the elderly person isn't aware of their lapses or difficulties, but those around them start to say, they're not quite the same anymore. This outside perception is clinically valuable and should be taken seriously when deciding to seek help. In addition to cognitive symptoms, emotional or behavioral changes can also be warning signs. Irritability, withdrawal, loss of interest in once enjoyed activities, sudden mood swings, or unfounded suspicion should all be closely monitored. These symptoms aren't always psychological in origin. Many are linked to neurological dysfunctions that require evaluation. The ideal starting point is a consultation with a general practitioner or geriatrician who will perform an initial screening and, if necessary, refer the patient to a neurologist or psychiatrist specializing in cognitive disorders. During the assessment, the doctor may request cognitive tests, lab work, and brain imaging to better understand the situation. Seeking medical help early has several advantages. First, it can reveal treatable conditions behind the symptoms, such as vitamin deficiencies, hormonal imbalances, side effects of medications, or depressive episodes. All of these can impact cognition and are reversible with the right treatment. Even when the diagnosis points to a neurodegenerative condition like Alzheimer's, early monitoring allows for interventions that can slow disease progression, provide support to the family, and help maintain the senior's autonomy for longer. A diagnosis doesn't have to be a sentence. It can be the starting point for more effective care. Avoiding or delaying medical help out of fear, shame, or denial only increases the older adult's vulnerability and emotionally burdens those providing care. In this context, caring also means having the courage to face the unknown with information and professional support. Possible reversible causes. It's not always dementia. When an older adult begins to show signs of mental confusion, memory lapses, or behavioral changes, it's natural for the word dementia to come to mind. However, it's important to understand that not all cognitive decline is irreversible. There are several medical conditions that can mimic the symptoms of diseases like Alzheimer's, but are treatable, and in some cases, even curable. One of the most common causes is depression, particularly in the elderly. Known as depressive pseudo-dementia, this condition can lead to apathy, lack of concentration, forgetfulness, and slow thinking. Often the person seems disinterested or confused when, in fact, they are experiencing depression. With the proper treatment, cognitive symptoms often improve significantly. Vitamin deficiencies, especially vitamin B12 and folate, can also impair brain function. These nutrients are essential for the nervous system, and their absence may result in confusion, irritability, memory loss, and even hallucinations. Diagnosis is done through a blood test, and treatment is straightforward: vitamin supplementation. Hormonal disorders such as hypothyroidism are another possible cause. An underactive thyroid can decrease concentration, cause excessive fatigue, and affect memory. Thyroid imbalance is relatively common in older adults and can usually be managed effectively with medication. Dehydration is another frequently overlooked factor. Seniors tend to feel less thirst and often consume less fluid, which can impair brain circulation and produce symptoms similar to cognitive decline. This issue becomes even more severe in hot weather or during illness. Medication use is also a key consideration. Many commonly used drugs, such as anti-anxiety medications, antihistamines, or painkillers, can cause cognitive side effects, especially when taken in combination or without close medical supervision. This is why any noticeable change in behavior or mental function should be evaluated by a healthcare professional. Only a medical assessment can explore all these possibilities and determine whether the cause is a side effect, a nutritional deficiency, or truly a neurological disorder in progress. Before jumping to a definitive diagnosis, think in terms of careful investigation. Because yes, there are reversible causes, and in many cases, relief begins with a simple test. What to do after a diagnosis? Receiving a diagnosis of cognitive decline, whether mild or associated with a neurodegenerative condition like Alzheimer's disease, is a delicate moment. Many families feel lost, anxious, or even paralyzed by the news. But it's important to understand, a diagnosis is not the end. It's the beginning of a new kind of care, one that is more focused, informed, and often lighter than expected. The first step after the diagnosis is to seek reliable information. Understand what the condition means, its causes, its progression, and most importantly, what resources are available to manage it. Doctors, occupational therapists, psychologists, and support groups are essential allies during this phase. Stay away from miracle cures or sensationalist content. Well-founded information brings clarity and helps reduce fear. Another crucial point is organizing a care plan. This includes adapting the daily routine of the older adult, creating strategies to make daily life easier, and promoting safety. Small environmental changes, like labeling drawers, using visual reminders, and reducing confusing stimuli, can make a big difference. When there's a risk of accidents, measures such as installing grab bars, avoiding loose rugs, and improving lighting are essential. In addition, it's important to focus on overall health prevention. Regular physical activity, a balanced diet, and managing conditions like high blood pressure, diabetes, and cholesterol all help keep the brain active and the body more resilient. Cognitive stimulation, reading, memory games, social interaction, and learning new things should also be part of the routine, always respecting the individual's pace. The emotional aspect also deserves close attention. A diagnosis can trigger feelings of grief, anger, fear, or frustration, both for the person diagnosed and for caregivers. Acknowledging these emotions and seeking psychological support when needed is an important act of self-care. Caregivers can also burn out if they don't receive support themselves. Another essential point is open family communication. Sharing responsibilities, discussing expectations, and aligning decisions help prevent overload and future conflicts. If possible, record the preferences of the older adult while they are still mentally aware. This will be invaluable for ensuring their wishes are respected later on. Finally, remember, a diagnosis does not define the person. An older adult with cognitive decline is still someone with a life story, desires, emotions, and abilities. Their value is not diminished by the disease. The focus of care should always be on quality of life. And that is possible at every stage of the journey. The impact on caregivers and family members. When someone is diagnosed with cognitive decline, the news doesn't only affect the patient. It deeply impacts everyone around them. Children, spouses, siblings, and close friends are often the first to take on the role of caregiver, even when they're not emotionally, physically, or psychologically prepared for this new reality. The impact begins with the shock of transition, a reversal of roles. Caring for someone who once cared for you, making decisions on behalf of someone who used to be a symbol of wisdom and independence, can stir up a whirlwind of emotions. It's common to feel sadness, guilt, anger, and confusion, all while experiencing deep love and a strong desire to protect. Many caregivers face what is known as anticipatory grief. Even though the person is still alive, there is pain in watching their abilities gradually fade. This creates an ambiguous sense of loss, a mixture of presence and absence. It's essential to name this grief and understand that it's valid. Denying it only deepens the emotional burden. The practical strain is also real. Caregiving demands time, energy, and organization. Doctor's appointments, routine changes, medication management, and often constant supervision can interfere with a caregiver's professional life, rest, and even personal relationships. That's why it's crucial to recognize personal limits and accept help, whether from other family members, friends, or professionals. Another sensitive issue is isolation. Caregivers often feel alone, misunderstood, or even invisible. In these cases, joining support groups or talking with other caregivers can be transformative. Listening to and being heard by people who share similar experiences offers comfort and strengthens a sense of belonging. It's important to remember taking good care of someone also means taking care of yourself. Eating well, getting enough rest, maintaining meaningful relationships, and seeking moments of joy are not luxuries. They are necessities. Exhausted caregivers are at greater risk of becoming ill. And when that happens, the entire support system can start to collapse. Prevention and care, the power of an empathetic and anticipatory perspective. Considering everything discussed so far, it becomes clear that cognitive decline doesn't happen suddenly. It gives signs. That's why cultivating an empathetic and anticipatory outlook makes all the difference in the care journey. This perspective begins before any diagnosis, through attentive listening, loving observation, and the willingness to notice even subtle changes. Empathy in this context is not just an emotional stance, it's also a tool for caregiving. Seeing the elderly person beyond their symptoms, embracing their vulnerabilities without judgment, and respecting their pace are actions that help create a safer and more nurturing environment. Instead of correcting, shouting, or rushing, the empathetic caregiver asks, invites, and accompanies. Prevention, although often overlooked, is one of the most powerful pillars of care. Stimulating the brain, nurturing emotional health, maintaining social connections, engaging in physical activity, and following a balanced diet are all habits that help protect cognition and delay the onset of more severe symptoms. Caring in advance is caring with love. Prevention also includes honest conversations, organized documents, structured routines, and above all, quality time spent together before the losses become more intense. It's important to remember that care begins before it's urgently needed and becomes stronger when it is shared, planned, and supported by emotional bonds. When we look with empathy and act in advance, we transform fear into presence and uncertainty into a continuous gesture of love. To care is also to understand. We've reached the end of this journey, exploring the signs of cognitive decline, how they differ from natural aging, and the importance of acting with clarity and responsibility. More than simply gathering information, the true invitation here is to make caregiving an experience grounded in knowledge, and above all, in understanding. Understanding that aging brings changes means accepting that each stage of life has its own characteristics, and that not every instance of forgetfulness is a sign of illness. At the same time, recognizing warning signs allows for early and effective action, seeking medical help, and supporting those in vulnerable situations. Caring is not just about managing symptoms, it's about embracing life stories, respecting individual rhythms, and preserving dignity. It requires a watchful and compassionate eye that acknowledges both the losses and the abilities that remain. Family members and caregivers play an essential role in this process, but they also need to care for themselves to maintain their own physical and emotional well-being. Open communication, thoughtful planning, and professional support form the foundation of compassionate, human-centered care. The more qualified information we have, the easier it becomes to face uncertainty and reduce suffering. And finally, remember, to care is an act of courage and love. It's about showing up even when things are difficult and finding meaning in the shared journey. May this video have helped shed light on a delicate topic, offering tools so that you, whether you care for or live with an elderly person, can act with greater confidence and calm. In this way, we can transform the challenges of aging into an opportunity for connection, respect, and hope.